here. All right, we'll go ahead and begin. Just so everyone knows, this meeting is being recorded, so please keep yourself on mute until it's time to introduce yourselves. All right, welcome everyone, and thank you all so much for being here today. You all can keep yourself muted. Thank you. Thank you all for being here today for our December. Okay, there we go. For our December Tobacco Prevention and Cessation Coalition meeting. If you have not put your name in the chat, please do so. And we will now just jump right into introductions. For the sake of time, as we do have a guest speaker today, please put any announcements you have in the chat box, or you can also email me after the meeting and I'll make sure that gets distributed to everybody. All right. So every attendee will be called on and asked to briefly introduce themselves. I will go ahead and get started. So my name is Melina Rivera, and I'm the Tobacco Program Coordinator for Healthy Communities of LaPorte County. I will go ahead and pass it to Sue Reed.
Good morning, everybody. Sue Reed. I'm the Executive Director here at Healthy Communities. Hope you all have a great holiday season.
Thank you, Sue. Let's see. Rashana, would you like to introduce yourself?
Hi, I'm Rashana, the Enrollment Specialist with Healthy Communities of LaPorte County.
And Rose? Oh, I think you're on mute, Rose.
Good morning, everyone. My name is Rosemarie Joyner. I am the Outreach Specialist here at Healthy Communities of LaPorte County. And I also am involved in the Voice program as well. Thank you.
All right, let me start calling participants here. I see Christine.
Good morning. Christine Rosenbaum from LaPorte Community School Corporation. I'm the mental health counselor and prevention educator.
Thank you, Christine. Jenny Diaz.
Good morning. Jenny Diaz, Community Marketing Representative for CareSource, covering the Northwest region.
Thank you, Jenny. Lee Morris.
I'm Lee Morris, community volunteer from LaPorte.
Thank you. Liz.
Hi, good morning. I'm Liz Pina. I'm the Outreach and Enrollment Specialist for the Healthline Clinic here in Kansas.
Thank you. Jennifer Heath. Jennifer Heath.
Sorry, it's hard to hear you here. I'm Jennifer Heath with Swanson Center, and I help with their Foundation for Behavioral Health.
Thank you. Katie Sarver.
Hi, I'm Katie Sarver. I'm the Manager of Community Programs and Wellness Outreach for Northwest Health.
Thank you for being here. Tay.
I am Tay Luttridge. I'm with Artemis for Healthcare Liaison.
Thank you. Shirley.
Good morning. Happy holidays. Merry Christmas. Shirley DuBois, North Region Tobacco. Almost said Howard County. I am the North Region Director with Indiana Department of Health, TPC.
Thank you, Shirley. Nikia Bonds.
Hi, I'm Nakia Bonds. I'm the member advocate with Anthem Medicaid programs.
Great, thank you. And Kelly Oliver.
Hello, I'm Kelly Oliver. I am the lung nurse navigator with Franciscan Health Michigan City, located at the Woodland Cancer Care Center.
Thank you, Kelly. I don't think I see anyone else. Is there anybody I missed? I'll introduce our guest speaker in just a second. All right. Thank you all again for being here and sharing. Um, let's see. I will go ahead and introduce our guest speaker. I would now like to introduce Miranda Spitznagle. She's the Director of Tobacco Prevention and Cessation at the Indiana Department of Health, and she's going to be speaking with us today on the Indiana Strategic Plan for Tobacco Control. Miranda, thank you for being here, and I will stop sharing my screen, and you should be able to share yours.
Okay, great. Hopefully you see a slide presentation.
Yep.
Great. And can you hear me okay?
Yes.
Even better. Okay. Well, thank you all for inviting me to join you this morning. It's been amazing to see how everyone has adapted in this time to still gathering and still doing the work of local tobacco control, and definitely looking forward, happy to be here in this format, but definitely looking forward to gathering together around a table very soon. So I wanted to just take a few minutes this morning, again, kind of walk you through our state tobacco control strategic plan for the next 5 years. And wanted to really start with what our vision and mission is for Indiana tobacco control as we move forward for the next several years. One of the things that I think is important to note is that we really are starting to shift our language and how we talk about tobacco products in particular. And throughout the plan and really throughout our work over the next few years, really focusing on what we talk about as commercial tobacco products. So those are those products that are made by the main manufacturers of tobacco products, and really having that distinction between products that may be used for sacred or ceremonial use. Through our work, not only at the state level, but through any of our local community partners, our statewide and health systems change partnerships, really wanting to achieve health equity by eliminating the disease and economic burden that is associated with the use of commercial tobacco products. And from our values, just recognizing that all Hoosiers are affected differently across a variety of racial, ethnic, and socioeconomic groups, and really striving to address these tobacco-related disparities. In the plan and in our work, described values for our tobacco control movement here in Indiana. Specifically on the left-hand side are some specific values that our program and are striving to achieve, wanting to make sure that we continue to have honest and open communication through transparency. As we talk about diversity and inclusion, really embracing the uniqueness of each person and seeking fairness and justice for all, and just wanting to constantly welcome different perspectives in our work. Partnership and collaboration is certainly a key. We can't accomplish the goals and the strategies that are outlined in our plans without those strategic partnerships. And then empathy, having this understanding that lots of Hoosiers continue to suffer from tobacco addiction and exposure to tobacco products, and approaching that work with compassion. And then on the right-hand side are values that are part of the Indiana Department of Health strategic plan, really working towards, valuing health equity, communication, innovation, and then integrity through the work that we do. Just briefly, that health communities of LaPorte County and the partners that you all represent in LaPorte have been doing this work for many years, and we always want to just pause and acknowledge, what work has been accomplished to date. So this slide just really very briefly represents some of the accomplishments we made in the last 5-year strategic plan, knowing that we've been able to increase our smoke-free environments with public schools, public housing units. We have seen a decline overall in cigarette consumption, and really celebrating our quit rate that we have through the services provided through the Indiana Tobacco Quit Line, and hoping to see that continue. As we, as we put together the plan, we had numerous stakeholders as part of this process, had a chance for engagement and feedback from a lot of our partners and stakeholders around the state as we developed the plan, but we also looked at the landscape, sort of what's happening in the tobacco control space, not only here in Indiana, but also across the country. So this slide just summarizes many of those topics. Within the plan itself, we have a brief description about what's happening as it relates to tobacco product marketing, regulation of tobacco products, and a lot of some of this really does fall to the Food and Drug Administration and the Center for Tobacco Products and their work at the federal level. What's happening with respect to flavored tobacco products, and this includes menthol products in particular. There's, again, been some indication at the federal level of some action hopefully being taken in that area, but certainly throughout that calls on state and local communities to continue to educate its community and perhaps pass policies locally as well. Price strategies, we know, price, whether it be through couponing or taxes or other means in which being able to raise the price of tobacco products continues to be a key strategy in preventing initiation and helping people quit. We're also continuing to monitor our surveillance, or looking at our surveillance data with respect to the fact that a lot of co-use of tobacco products happens. So not only just the use of tobacco products, but use among other substances, specifically marijuana, is something that we're paying attention to. Looking at the underlying causes of addiction as it relates to adverse childhood events, other social determinants of health, and really just looking at the intersections of those factors. And then as we talk about treatment, early in 2020, there was a release of a Surgeon General's report on smoking cessation. It was the first one that came out in about 30 years, and it really just brought to the forefront the evidence base of all of the tools that we do have to help people with their tobacco addiction, and just reminding of those great resources that are available through healthcare providers, through quit services, through state quit lines and things like that. A lot of the strategies that you're implementing at the local level. And then just acknowledgement that the pandemic has provided a lot of challenges, yet perhaps opportunities as it relates specifically to increasing our smoke-free air environments. And then I always like to include this slide in particular. I'll kind of put it all out here at once. Several years ago, our colleagues at the CDC, our National Program Office, really started to talk about what works in state, specifically state tobacco control, but state and local tobacco control efforts as a concept of a vaccine. And for those of us who have done this work for a really long time, you often get pushed and asked about, well, what's the one thing that really works in tobacco control? And the thing is that it's not just one thing. It's a combination of these factors, strong smoke-free environments, high prices on tobacco products, limited access to tobacco products, yet great access to treatment resources and media campaigns. We knew all of these factors working together. And then they wrote up a paper, and it was really kind of coined the tobacco control vaccine. A few years later, add on all of the body of work that we've been monitoring with related to point of sale activities and being able to limit access to tobacco products and marketing at that point of sale, that tobacco retail environment. That's really kind of been called the vaccine booster. And really, I think connecting it to your work locally is that, the tobacco store retail audits, that work that you're going to be doing in that first quarter of 2022 is key to not only collecting that local data, but really continuing to make that case as to why we need stronger regulation and more activity happening at that point of sale in order to limit availability of tobacco products. So to the plan specifically, we outline the plan in these 4 areas. A lot of your work is really grounded in these 4 areas as well. So I'll just touch on them briefly. The objectives listed here for our youth and young adult priority area kind of speak to some targeted areas. We want to make sure that we're really lowering and paying attention to e-cigarette and vape use among youth and young adults, really looking at flavored tobacco products among our youth as well. But just because there's a few objectives here, and then on the next few slides, there's many within the plan itself, and they'll be outlined related to some long-term strategies, some intermediate objectives, and then some short-term ones as well. And then within the plan, numerous strategies, whether they happen at the state, at the local level, whether it happens through media and communications or cessation interventions, a variety of strategies under each of these priority areas. So we know that school engagement and strengthening school policies is important. Continuing to support our young people through leadership and engagement and advocacy activities are key. And then series of things about what we can do to reduce exposure to commercial tobacco product marketing, things to increase access to treatment resources for those young people who may be using tobacco products, including e-cigarettes, and then just monitoring the tobacco use trends. And so not only is that a key for your local point of sale audits, but also as we engage and ask schools to participate in the youth tobacco survey, for example. As it relates to secondhand smoke, we know that there's still a lot of need and a lot of disparities in certain communities and in certain sectors of the population as it relates to smoke-free air. And so our goal is really, we want smoke-free environments everywhere. When we say smoke-free, it's not only secondhand smoke exposure from a traditional combustible product like a cigarette, but we're talking about secondhand aerosol as well, and making sure that we're really getting all of that smoke outside. We know that there's a lot of concerns as it relates to chronic health conditions and other exposures that can be exacerbated by exposure to secondhand smoke. And so lots of opportunities to improve and really further those public health protections as it relates to smoke-free air. Cessation, we know, not only across the general population, but in certain subpopulations, whether it be pregnant women, those with mental health conditions, those perhaps served by Indiana Medicaid, we know that we've got some targeted areas to focus on as well. We're doing that again through a variety of ways. And I'm partnering with healthcare providers around the state to really implement systems changes. So, what happens in that workflow when somebody walks through the door of a healthcare provider? Are they asked about their tobacco use status? Are we able to connect them to resources, whether that be an in-house program or whether that be through services through the Quit Now Indiana, their Indiana Tobacco Quit line? Continuing to really train up and educate healthcare providers across the continuum. Maybe it's just the social service providers in the community. Many of you just making sure that perhaps even just having those quit resources at your point of care or point of education to encourage folks to take advantage of those opportunities. Trying to meet consumers where they are. We, again, welcomed some of your input as well as about what's working in your community, but trying to make sure that we're making it accessible for folks to access services through Quit Now Indiana, whether it be text messaging, web-based options, and other points of care. And just making sure that we're doing everything that we can to eliminate some of these barriers to getting people access to treatment. And then finally, none of this work, whether it relates to youth and young adults, smoke-free air, or getting people access to tobacco treatment, is going to work if we don't have a strong infrastructure, program sustainability, collaboration among partnerships. And, not only does that happen at your local community level, but it happens across the state where we're really being able to work together, figuring out ways that we can support each other in our messaging and our communications, and making sure we've got the ability to get, again, these services to those in need. Really focusing on ways that we can do a better job collecting data, making sure we're collecting data among the populations, and working with those communities and populations most in need. And just having this increased awareness about the ability to collaborate and intersect with our work. So, as we were, thank you very much for your partnership for many years. And, we at the state level want to continue to support your coalition and your community. And just with that, I thank you for allowing me the time to speak with you this morning.
Thank you so much, Miranda. Does anybody have questions for Miranda? Any at all? So the Indiana Department of Health and the Tobacco Prevention and Cessation Commission that Miranda leads is our funders. So we are just a local coalition that is following their strategic plan to really help tobacco control on a local level. Any questions at all? All right. Well, thank you so much, Miranda. On behalf of Healthy Communities of LaPorte County and our coalition, we are so excited to continue our work here on a local level towards improving tobacco control. So thank you so much for being here.
Thank you for having me, and let us know what we can do to help you be successful.
Absolutely. All right, everyone. We will go ahead and move on here. Let me share my screen again. All right, so let's move on to deliverable progress. So starting with the Indiana Tobacco Quit Line, I wanted to mention a few updates here. We did enroll two new preferred providers through the Quit Line's Preferred Provider Network. So thank you to Katie Sarver from Northwest Health and Kelly Oliver from Woodland Cancer Center for enrolling as a preferred provider. You are both now even more equipped to supporting your patients on their quit journeys. With smoke-free multi-unit housing, I did want to mention that we got connected with the Michigan City Public Housing Authority through Liz Pina. So thank you so much, Liz and HealthLink, for helping us get that connection. She invited us to be a vendor at a vaccine pop-up at the Housing Authority, where I not only met the Housing Authority, but also Minority Health Partners' new executive director, who's also working on some housing initiatives. So I'm working on meeting with both of them. And I'm also meeting with Angie Nelson, a Michigan City City Council member, tomorrow, who is on their Public Health and Safety Committee. Thank you to Lee for helping make that connection. And we are now one step closer to helping multi-unit housing go smoke-free to protect more residents from the harms of secondhand smoke. So thank you all who helped with that. And then moving on to tobacco-free work sites, which is our policy work. We hosted a virtual walkthrough of the community readiness profile document. And not many attended, but from those that did, we got a lot of great insight and ideas to help us move forward. So from that meeting, we were able to secure a slot at the LaPorte Economic Advancement Partnerships Legislative and Affairs Advocacy Committee. And Sue and I spoke to that group about the community readiness profile and how we are trying to assess our community's readiness to have a 100% comprehensive smoke-free air policy here on a local level. And we tried to get their assistance with it and also to just gain their support for smoke-free air. And it went really well. And to our surprise, the mayor of LaPorte was actually in the room, so we were able to present to him as well. And he did express interest in showing support for smoke-free air in LaPorte County. So we're definitely going to leverage that connection and maybe set up a meeting to speak with him further on that. But we're really excited about the progress so far, and we have some really great ideas going. But this is a living document to help us assess our community's readiness and start planning for taking action. Um, if Feel free to use that Google Doc link I sent out to continue to work on it, whatever questions you're able to answer. I'm going to be doing the same from now until about December 30th. Um, and then in the new year, we're going to be trained on how to utilize that document to then formulate a strategy or a plan of action to really try to get the momentum going.
Melina?
Yes.
Yeah, I'm sorry. So you presented to, what is LEAP?
LEAP is the LaPorte City Chamber of Commerce.
Well, it's the LaPorte Economic Advancement Partnership.
Thank you.
It's the combination of the Chamber of Commerce and the Economic Development Corporation.
So it was a great audience to present to. Way to go. Way to go.
Thank you. Thank you. And thanks for your help, Lee. So that was a great update. I now want to talk a little bit about some upcoming deliverables. So for tobacco-free schools, upcoming deliverables to analyze current tobacco-free school policies within our county. We do have connections with the Michigan City area schools and then also LaPorte Community School Corporation. But I wanted to know if anyone in the group has contacts at New Prairie United School Corp. If you do, please let me know. I would love to reach out to them to take a look at their policy as well. And then once we analyze those, we can then formulate a plan on how to maybe help provide them with some options for alternatives to suspension if they have tobacco grounds policy violations and things like that.
Melina, I will send you contact information for each of the other school systems in our county.
Thank you, Lee. And then I also wanted to bring up point of sale tobacco marketing, which is a big one coming up. And I'm going to move on to the next slide. I just want to give you some, explain it just a little bit more before talking about the deliverable. So what is point of sale tobacco marketing? It is marketing of tobacco products to consumers at the point of purchase. So in retail stores such as gas stations, convenience stores, tobacco shops, and more. And this can be price promotions and discounts, in-store product displays, product placement, and retail advertising. And so on the right, you'll see two pictures. On the top, there's an interior picture of what point of sale marketing looks like. And then on the bottom, it's exterior point of sale marketing. So I want to point out that this type of marketing is not random. Retailers often have contracts with tobacco companies that specify where to place or where tobacco products have to be placed, what height, what proportion of the display needs to be a certain product. And it's very intentional and often manipulative form of marketing. And the tobacco companies knows that it works. So the deliverable for point of sale is that we want to participate in the standardized tobacco assessment of retail settings, STARS. And this is a survey that we do every 2 years. And it's to collect county level data on tobacco products and point of sale advertising in retail establishments. So a little bit more about those assessments is that tobacco retailers are randomly selected for assessments within 35 of the 92 Indiana counties, and LaPorte County is one of those counties that are selected to do these surveys or audits. And so basically we go into those retail establishments, gas stations, convenience stores, etc. We're provided a list and we use the STAR survey to then assess the retail environment. So we collect data on product availability, price and promotions, product advertising, and more. And so in 2020, the assessments were done between February and August. That was an extended time period just because of the pandemic. This year it's going to be shorter time frame, next year. And then in 2020, there were over 2,000 assessments completed in 35 Indiana counties. And here in LaPorte County, we assessed 115 local retailers. And so I wanted to speak a little bit about the results from what we found in 2020 here in LaPorte County. So I wanted to speak about the LaPorte County tobacco retailer density. So when we study tobacco retail environment, we often talk about density, and that's just to measure how many tobacco retailers there are in a particular location. So in this case, we measure density as the number of retailers per 1,000 population, as you see on the left. And when you look at the tobacco retailer density here in LaPorte County, we can see some areas have a higher density of tobacco retailers than others. There's some in the middle there, and then in the northwest corner in red. Can you keep yourselves on mute, please?
Oh my gosh, it's driving me nuts. I have to manually change it every time. Like, oh my God. Because I'm gonna be in a hurry one day and I'm gonna send it.
All right. So as you see in the center there, and then the northwest corner, there's a higher density of retailers. And so these areas are often,
Take a left.
I'm gonna try
There's
to mute this person.
you know where our little lunchroom is right there? It's in that room.
All right. So those areas with more tobacco retailers are often known as tobacco swamps. And those swamps are usually in lower income communities and communities with a large amount of minority groups and other vulnerable populations. And so on the right, we have the percentage of the different settings that we assessed. So as you see in 2020, that most of the retailers we assessed were 60% were convenience stores, and then liquor stores and also tobacco shops were the largest amount of retailers that we assessed. So it's going to look pretty similar this in 2022. I can't move this. Okay. So I wanted to talk about the youth targeting and youth appeal. So 26% of the tobacco retailers that we assessed in 2020 had tobacco advertisements at child's eye level, so within 3 feet of the floor. 25% of the retailers had tobacco near candy, soda, gum, ice cream, and toys. 97% sold cigarillos priced less than $1, and 89% sold single cigarillos. And the cigarillos is important because children and youth are price sensitive. So if there's something that's extremely affordable, they're most likely to buy them. Cigarillos are also very small, so they can be easily hidden and discreet. And with all of these percentages here, LaPorte County had a higher percentage than the other 35 counties in Indiana. And I also want to point out that 98% of the retailers in LaPorte County sold flavored tobacco products. And we know that youth appeal to those flavors. There's thousands of them. And then 62% of retailers in LaPorte County offered any tobacco price promotions. And we know that these price promotions and discounts lead people and youth to purchasing these products. And then I just wanted to point out some takeaways here. The tobacco industry relies heavily on point of sale tactics to market their products. They spend billions of dollars each year on point of sale marketing because they know that it works. Point of sale marketing encourages youth to start using tobacco. It makes quitting more difficult. You don't even have to go into the store to see these advertisements because they have a bunch of exterior advertisements as well. It disproportionately targets some communities As you remember in the last meeting, I talked about Project Scum and how the tobacco industry was trying to get more consumers from the homeless and LGBTQ plus populations, and they called that initiative Project Scum, which shows just how much they care about certain groups of people. A high proportion of tobacco retailers in LaPorte County engage in point of sale tobacco marketing, as you saw from the results. They display tobacco advertisements, engage in price promotions and discounts, and then they promote cheap, flavored, youth appealing products. So I say all this to say that this point of sale marketing, it's important to work on this initiative. So assessing the tobacco retail environment will help us do that. We can then spread community awareness on the issues happening in our county regarding the retail environment, and then educate local legislators on these issues to gain their support moving forward. With that said, we would like to ask for volunteers for the 2022 tobacco retail audits. So we are asking for a minimum of 25 volunteers. So far, I'm looking through the initial list of retailers they sent me, and there's over 110 right now. So it's quite a bit. So the more volunteers we can get, the better. These audits will take place between February 15th and April 1st. And there will be a training in early February on how to do these assessments. So whoever wants to volunteer, I will make sure they have access to that training. And the volunteers can be anybody at all. They don't have to be on our coalition. They could even be youth. It could be great for like a leadership group in schools. So I would like to ask you as a coalition for your help, but also if you can then go ahead and spread the word, and if you can help us recruit volunteers as well, that would be amazing. So now I'm just going to sum up a little bit about what we discussed and tell you some action items. So by December 27th, if you all can send me school contacts, especially from New Prairie United School Corporation, or even virtually introduce me, that would be great. Let me know if you're interested in volunteering for our point of sale assessments and audits, and then help me recruit more volunteers for it. That would be awesome. And then going back to the community readiness profile, if you're able to contribute to that document, that would be wonderful as well. So that is everything I have for today. Thank you all for being here. Our next meeting will be in the new year, January 26th at 10 a.m. And I just want to wish everybody happy holiday, and thank you again.
Happy holidays to you too, Melina, and everybody else.
And to you, happy holidays. Thank you.
Mm.